Hi there. Today we're going to cover our first category of nematodes. Nematodes being our cylindrical worms, worms that are cylindrical in diameter. And we're going to cover roundworms and hookworms in this non-traditional lecture format. As we progress through the PowerPoint, this is the PowerPoint that you have access to. Also have available your lecture packet, as that will allow you to write any additional notes and comments just like you would in a traditional classroom setting. So, our true roundworms are our nematodes, and again, those are the worms that are cylindrical in diameter, not our flat worms, our flat segmented worms, or our flatworms. I will try to utilize the language that I introduced you to in our first two classes together as this language we are going to use throughout the course of the semester. So I'll give you some examples of how they apply. Anytime you see the term ascari, if you've taken medical terminology, you know that ascari pertains to any sort of roundworm, any sort of worm that looks like a piece of spaghetti like this. Now, as we talk about all of the true roundworms, all of the nematodes, however you'd like to say that, they're all cylindrical in diameter. But if you want to think of like a piece of spaghetti, those are one kind of nematode, hence the roundworms. Iasis is an infection, so an ascariasis would be a roundworm infection. And you're going to see that all puppies, all kittens are born with a roundworm infection or are afflicted with ascariasis. Our first category, our first roundworm specifically in our discussion of roundworms as they pertain to small animals, cats and dogs, Toxicaricanus biphar is so common. And by the end of this module, you will see why they are so common and why we are going to deworm 100% of puppies. Host for Toxicaricanus, again for lab, you know that you are going to be tested on the genus, but the scientific name, the genus and the species, gives you some insight of the host that it affects. We would know this as commonly as the roundworm or the roundworm of dogs. Again, our focus is going to be small animal, cats and dogs, but I have here canids. And so if you have an interest in wildlife, more specifically your wolves, your coyotes, and rehabilitation of that species, then you certainly would know that you would need to deworm all of your wolf cubs. All roundworms, you're going to see all roundworms, cats, dogs, guinea pigs, humans, all adult roundworms are going to reside in the small intestine. I put on the PowerPoint, in all of the PowerPoints, pictures of adults and eggs, just to help reference lab. If you see it more, you'll have that image tattooed in your mind. Remember that this egg, all roundworm eggs, have a very thick membrane, and I wonder if you remember why we have that thick membrane, like that nice winter coat to get them through some harsh environments, some harsh climates. You have that dark brown filled in center. Today, just like our first lab, you're going to see that this egg, the inside of this egg can change. It actually matures when we talk about the life cycle, but on a fecal flotation, which is the most common way to diagnose roundworms, you're most likely to see this type of egg. Adults, roundworm adults. Let me throw away my gum, sorry. Roundworm adults, again, look like a piece of spaghetti. 18 centimeters long. This is a full ruler, so about that long as an adult in the dog. So if the animal were to defecate or to vomit out a worm, you're very likely to see it. And it might even be alive. Again, two common reasons why you are likely going to see an adult roundworm or adult nematodes for that matter is because you've dewormed them and hence they are dying and are coming out, or if the animal has an aggressive case of vomiting or diarrhea, and that spasms can force them out. Dogs inhabit every continent on our planet, and so you can imagine that Toxicaricanus is found worldwide. But with that being said, obviously all states in the greater United States have puppies, have dogs, and so hence have Toxicaricanus. Now, I'm going to spend a little bit more detail talking about three terms. Somatic migration, the next slide says hypobiosis, and the next slide after that says tracheomigration. All of these next three slides are discussing how the parasite migrates through the body to ultimately become an adult. And we know that when we are an adult, we are sexually mature and we can reproduce. Somatic migration, hypobiosis, and tracheal migration are all pertaining to a direct life cycle. There are only two types of life cycles, a direct life cycle and an indirect life cycle. All roundworms have a direct life cycle, all roundworms, including Toxocara canis. But I want to discuss these three terms so that if you read another parasite and it says somatic migration, you'll know what it means. Somatic migration and hypobiosis are the reasons why puppies are born with this parasite. Let me explain. The infective stage of the egg. You saw the picture of the egg not too long ago. Here it is. The infective stage actually looks very similar, but instead of this dark brown filled in center, you have a microscopic larva. When the animal defecates out, when mom and dad copulate in the intestines, reproduce, this stage of egg is shed in the feces. It ultimately will mature to the point where it has a free-floating larva inside. That is the infective stage. I would never test you on this term right here. L stands for larva, and it's just the infective stage. That larva is inside that membrane. That is the stage that needs to be ingested by a canid. In the dog, when it's swallowed, the egg will go down the esophagus, down into the stomach. Hydrochloric acid does not kill these eggs. Doesn't that amaze you? And then it will go into the small intestine. When that happens, that larva is going to kick open that membrane, break it, and emerge from the egg. That is then going to migrate through the intestinal wall. So it leaves the gastrointestinal system. Ultimately, the end result of this, when the larvae migrate through the intestines, some of the larvae are ultimately going to become lost somewhere in the body. And think about times if you've ever been lost. It's scary. And for a parasite lost, they have a couple of options. They can die, or they can go dormant. They can insist. They can hibernate. And so these larvae, some of the larvae who, let's say, get lost, they choose to go dormant, go to sleep, in hopes that something will wake them up in the future, sometime down the line. Because again, this feeling of being lost, they don't want to die, so this is their best option. So when you see this term somatic migration, think of they go to sleep. They go for a long nap. This term right here, somatic migration, is also known as arrested development. So their development is arrested. It stops for a period of time. Now, the only thing that is going to wake them up are the hormones associated with pregnancy. So let's say you have some larva that got lost in Phoebe, my beautiful basset hound, female basset hound. She happens to be spayed. So an ovariohysterectomy. We've taken out her ovaries and her uterus. She's incapable of reproducing, and so she could never get pregnant. So hence she won't have the hormones associated with pregnancy. So if she did have some of the Toxocara canis larva in her tissues, they're never going to get woken up. So they will die eventually. What about Floyd, my beautiful male basset hound? He's a male. Will he ever be able to become pregnant? No. So hence they will always be dormant in his tissues until they die. The only thing that can wake them up are hormones associated with pregnancy, and this awakening of the larva because of the hormones associated with pregnancy, that is the term hypobiosis. So if you ever hear the term hypobiosis in your readings, it's the awakening of those dormant larvae. They will become alive again, and ultimately they will make their way into the fetus of the babies. And when the babies are whelped or born, that larva that is in the fetus will then get coughed up and swallowed and go down again into the gastrointestinal system. And that larva then, once it reaches the small intestine, will be able to become and mature into an adult. That is somatic migration, sleep, hypobiosis, the awakening. So again, you will appreciate in your readings other parasites that go through somatic migration or arrested development and hypobiosis, and now you'll know. But ultimately, both of these terms are representing a direct life cycle, one in which does not need an intermediate host. It just needs that primary host to fully reproduce. Whenever you hear the term tracheal migration, I want you to think about this. Let's say we did a fecal examination on one of my dogs, Phoebe is 4 years old. She has been dewormed as a puppy, because now you know why all puppies are born with roundworms. But what if we have a diagnosis of roundworms in her feces? How did she get infected? Well, a dog who has roundworms has adults present in the small intestine. That egg is defecated out in the feces. That egg is going to mature to that stage where you have that larva inside. And Phoebe would have needed to ingest that infective stage. That egg is going to go down the esophagus, down into the stomach, down into the small intestine, which then the larva is going to kick open that membrane and emerge and ultimately penetrate the intestinal lining, the intestinal wall, and eventually find their way into a blood vessel, the venous system, the veins. Ultimately, all blood is going to take anything to the heart, which then, after the heart, blood will go to the lungs. Those little larvae, microscopic larvae, those microscopic worms, are going to irritate that lung tissue, which then will cause the animal to cough, bring up phlegm along with the larva, then swallow it, which then will go down again through the esophagus, down into the stomach, down into the small intestine, which then we can mature into an adult. And when you're an adult and there's a male and female, you can produce eggs, and this cycle will continue. Again, this tracheal migration, the migration of the larva, eventually coming up into the trachea to be swallowed again, this is known as tracheal migration. And if Phoebe were infected with roundworms today, this is the process. This is the direct life cycle and the migration of the parasite through the body to eventually become an adult. Very complex. You just need to know that it's a direct life cycle of all roundworms. The dog, the canid species, needs to ingest the infective stage. So what if Phoebe went and found an adult roundworm and she ate that? She would not get roundworms because it's not the infective stage. We need to ingest this egg stage with that larva inside. If Phoebe ate that stage, nope, we would not end up with an ascariasis infection. We need to ingest specifically this stage. We now know that there can be transplacental transmission because of somatic migration and hypobiosis, that awakening of the larva to then migrate into the feces. We can also have transmammary transmission, and so larva from mom can be transmitted through the milk. So the act of nursing can also transfer the parasite. We also have some paratinic hosts. Now remember that the paratinic hosts are just transfer hosts. They don't aid in the parasite's life cycle. So if a squirrel ingested that infective stage, it wouldn't mature in this host, but if that dog ate that squirrel, yay, the parasite is very happy because now we're back inside the primary host. And if we're in the primary host, we can mature into an adult, and when we're an adult, we can make babies. I'm not going to test you on, hey, tell me 2 paratinic hosts. No, no, I would never do that. Certainly you can see that a lot of dogs hunt rodents, rabbits, and think of the Labrador retrievers, and all the retrievers, all they do is hunt birds. So a lot of potential hosts that can communicate it back to the dog. Now, I know this is not a dog, but when I scan the internet, I try to find some interesting pictures that aid in our discussion. I have starred common symptoms. I can put 10 slides of symptoms, possible symptoms of roundworms, but I want you to think of common ones. I want when you're being tested on this information, you got to think common ones, because these common symptoms are likely what you're going to see when an animal comes to you for your care at a clinic or at a hospital. Why is the hair so dry? Well, remember where the adults reside. They reside in the small intestine, and that's where nutrients are absorbed. And so because of that, the parasite is stealing the nutrients, and your hair and your skin can not be so healthy. So health can manifest in the integument system, the hair system, the hair coat. You can see that this individual's hair is kind of greasy. It's not very healthy. So that tells you that nutrients are affected. This person might have a problem with nutrition, which could be parasitic. Pot belly. This person looks like you have a little pot belly. Now, pot belly is not because the animal has a belly full of worms. This person could have 2 worms in his guts, but for some reason we have this edema in our belly. Certainly, if we have a lot of worms, that can cause some gastrointestinal upset. Certainly, if we have severe worm burden, a lot of worms in our intestines, stealing all those nutrients, can the animal become cachectic and emaciated? Anorexic, cachexia, they're all progression. Very malnourished? Absolutely. If we have a lot of larvae, so if we have a lot of parasitic burden, what if you have all these larvae coming up to be coughed up and swallowed due to tracheomigration? Certainly, I'm just saying it's not very common. My sister-in-law had a puppy, a basset hound puppy, that when she was young they got from a pet store, and little George had so many worms in his intestines that they obstructed, and it actually took his life. So there's a lot of things that can happen, but by far, bar none, these 2 symptoms are what you're likely to see, as they are the common symptoms. Pre-patent period. Remember, I'm not going to test you on 4 weeks. I'm not testing you on these values. I want you to understand the concept of pre-patent period. And it's again the time that dog in this case eats the infective stage to the time where we can diagnose it using a test. And later on you'll see the best mode, the best test for the diagnosis of roundworms is the fecal float. And here is a picture of the fecalizer that we're going to commonly use in our first couple weeks together. Common fecal float solution, Fecasol, which is a zinc sulfate type solution. There are many flotation solutions. And of course, we want to use fresh feces. Infection to detection is about 4 weeks. Again, application, what if an owner called you and their neighbors they claim they don't take very good care of their dogs, and their dog has stepped in fecal matter from the neighbors, and they suspect that they have roundworms or some sort of parasites. They want to check their dog's feces to make sure that it's healthy. You're not going to be able to pick up this parasite specifically for 4 weeks. Diagnosis again. We're likely to see this egg in our fecal float. Again, the possibility of finding adults is possible, but it's not very common, because remember, these worms don't want to be found. But again, if we've dewormed them, or if the animal has some gastrointestinal upset to cause vomiting and diarrhea, we could see them. Now, I'm never going to accept this term necropsy on a test, because again, our goal is to educate people, small animal owners. Annual fecal exams are recommended from the AVMA, and animals who are at high risk, so animals who commonly scavenge or are hunting dogs, AVMA recommends that we check their stool more than once a year, because again, they're more at risk. But I understand that if you had a little puppy like George who died very acutely, you may want to do a necropsy to see, certainly what took his life. But we'd like to catch it before that, annual fecal exams. I'm not going to test you on this. Recheck 1 month. We've talked last week about we always recheck post-therapy. So ultimately, when we do find a parasite, we are going to kill that parasite. We're going to send home the animal, send the owner home with some medication to kill this parasite. We always want to recheck to ensure that the parasite is gone, to ensure that the medications have done what they're supposed to do. Because sometimes medications are not 100%, nothing's perfect, nor the people who administer the medicines, nor are we 100%. Some of these animals are really sneaky and can spit out their pills, underneath the bed. You will see a common trend that you notice that the pre-patent period was 4 weeks. Recheck one month. Remember, recheck after therapy is complete. If humans were to ingest the infective stage, that larvated egg stage, we are not the primary host for Toxcarcanus. Only dogs are. And so this larva, when we ingest it, is going to migrate through our body and try to find a dog. Well, it's not a dog. We're not a dog. For some reason, these larvae like to go and specifically take up residence in the eye. So here, ocular pertains to eye, larva migrating into the eye. And so here's an ophthalmoscope, a scope looking at the eye, and you can see this is the optic disc, the back of the eye, and we have some blood vessels in the eye. This is a lesion, probably scar tissue caused by larvae. So is this going to kill you? No. Could it cause you some eye damage? Absolutely. Here is the larva migrating into the viscera, so tissues. And so depending on what tissues it migrates into can cause some damage. And here it's migrated into this superficial skin, causing a rash like. Is it going to kill you? No. Certainly, probably very uncomfortable. Now, let's take all the information from Toxcarcanus and apply it to Toxcar cati. This is the roundworm of cats. And you're going to see why all kittens should be dewormed for Toxcar cati. Hosts are our cats. And so if you are interested in large cat wildlife rehab, there you go. This will also apply to them. All roundworms reside in the small intestines. The eggs look identical to Toxcarcanus. They're just a little bit smaller. The adults look identical to Toxcarcanus. They're just a little bit smaller. Cats are all over the planet, every single continent, so you can imagine this is worldwide, obviously common throughout the United States. All roundworms have a direct life cycle. So the cats that have the adults in their intestines, if there's a male and female, we are going to reproduce and shed these eggs in the feces. The egg matures, and if the cat ingests that infective stage, shabam, we can now grow up to be an adult in the intestines, and the cycle continues. You can see here that off the beaten track we have the possibility of the squirrel. It says here, or the cat ingests a transport host, a paratinic host. And so we have a lot of paratinic hosts also with this parasite. The point here is the cat needs to ingest the infective stage, or the cat needs to ingest the paratinic host. There is also the possibility of transmammary. So there's no transplacental. The parasite cannot migrate from the mother to the fetus in utero, in the uterus. So no transplacental. But kittens will acquire this parasite because of the ingestion of milk. So the larva will migrate through the mammary glands, through the milk into the babies that way. So to argue, are kittens born with this parasite? No, but they're going to acquire it right after. Symptoms. I know that this is a dog and not a cat, but the same symptoms. Now, if we look at this puppy, of course it's a puppy, so we're going to treat it because all puppies are born with roundworms. But this puppy, does he have a pot belly? No, I think he's kind of chubby all the way around. But, things to consider. I just put some discussion there. Pre-patent period for Toxocara canis is twice as long as what it is for Toxocara canis, but again, I'm not testing you on that. It's just if you have a patient that you would like to diagnose roundworms in, you have to wait for this parasite 8 weeks, 2 months. We diagnose it the same way. We find the eggs in the fecal float, and again, it has the same zoonotic potential as Toxocara canis. Toxocariasis, an infection of Toxocara, by the CDC, the Centers for Disease Control, says this is one of the most common zoonotic infections on the planet. And usually the individuals that struggle with ocular larval migrans or visceral larval migrans are kids. And that's because they tend to put their hands in their mouth a lot. So their hygiene habits aren't as ideal as that of adults. We'll talk about protection of all sanitation habits a little bit towards the end of the roundworm module. Toxascaris is another genus of roundworms. So we've just talked about Toxocara. This is Toxascaris leonini. This is the common roundworm. This particular roundworm can affect both cats and dogs. So I have 2 dogs and 2 cats. And so if my dog had roundworms and my cat stepped in the feces and groomed himself, if we did have this species of roundworm, it can also be communicated to my cat and vice versa. All roundworms reside in the small intestine. This egg looks similar to Toxocara, but just slightly different. What is identical is the outer membrane. What is different is the inside. It's not dark brown. It's kind of lighter brown and very mottled looking. Adults look identical, so it would be impossible to determine if an adult roundworm was Toxocara or Toxascaris. All over the world, because cats and dogs are all over the world, so obviously the United States, all roundworms have a direct life cycle. Here's the big difference. The only way that Toxascaris can be transmitted from dog to dog, dog to cat, cat to dog, cat to cat, is the ingestion of the egg. More specifically, again, that infective stage. There's no other way, no transplacental, no transmammary. You have to ingest the infective stage, whether that be directly in the feces or that infective stage is in a transport host. One of the common symptoms of Toxascaris is diarrhea. You don't see diarrhea with Toxocara. If you had chronic diarrhea, can you imagine how that would certainly wear on you? So that's kind of chronic ill thrift. You just wouldn't feel as energetic. We do have a different preparation period. Again, not testing you on that. What you need to remember is the infection to detection with a test. We diagnose it the same way in the fecal float. Again, the possibility of finding adults is there, but again, usually the adults don't want to be found, so you're less likely to find them. This particular species of roundworm is not zoonotic. You're going to see that this is the only roundworm that is not zoonotic. Bayless ascaris. So ascaris ascari is in the name here, so you know it's a roundworm. Procyanus, this is pertains to raccoon. This means raccoon, and so hence this is the common raccoon roundworm. So yes, I know that we said that our focus is going to be small animals, cats and dogs, but I'm going to explain why we added this to the curriculum. AVMA told us to add it to the curriculum, and I'll tell you why. Because this says, even though this is named raccoon roundworm, it can affect many more species of wildlife, but it was first identified in the raccoon. All roundworms reside in the small intestine. Again, it looks, adults, they look very similar to Toxocara or Toxascaris, impossible to differentiate. And the eggs look very similar to Toxocara as well, so that dark brown filled in center, just like this. We have 50 species of wildlife that Bayless ascaris can inhabit, so North America, again, we discuss it because it's a common parasite here. All roundworms have a direct life cycle. Here's a big difference. Ultimately, how it's transmitted from one wildlife species to the next is the ingestion of the infective stage. Here's where it differs. Toxocara, when the eggs are defecated in the feces, it's only a short period of time for that egg to become infective. A day, 2 days, depends on obviously the outdoor, the temperature of the outdoors. Toxocara cati, same thing. Toxascaris, same thing. That egg becomes infective relatively quick. With Bayless ascaris, it takes the eggs 30 days to become infective. So let's say you are working at the Wildlife Rehab Center and you have a ward of raccoons and other wildlife species. What do you need to remember? You need to remember, time out for a moment. This infective stage, just like Toxocara, is zoonotic. So if we accidentally ingested it, we could end up with the same zoonotic infections as Toxocara. So if you work in wildlife rehabilitation, if you remember that it takes a month for these eggs to become infective, you know that you are going to be cleaning that habitat of the raccoons very frequently. Just like animal care, you clean the dog's kennels once, twice, 3 times a day. You are going to go into the raccoon habitat or to those wildlife habitats, and you're going to clean up their fecal matter so then it doesn't have the opportunity to grow, mature, and become infective. I'll tell you something else. This infective stage, see how the larva is just coiled up inside that nice warm outer blanket, that outer membrane? This infective stage, which again took 30 days to get to this point, this infective stage just in Bayless ascaris, not in any other roundworm species, can only be killed by fire. Ooh. That's dangerous. This is a very dangerous. So the likelihood that if this stage is present in the soil, and if we stepped in it and ingested it, we could end up highly with these zoonotic infections. So we got to make sure that we pick up that feces ASAP so that it doesn't have the opportunity to grow up. All of the other infective stages of roundworms, Toxocara, Toxascaris, can be killed by bleach, can be killed by the common disinfectants that we have here. Symptoms. You typically don't see symptoms in the natural host, which is raccoons and other wildlife species. But certainly, again, if that raccoon had an exorbitant amount of worms in their small intestines, certainly we could have problems associated with that. Bayless ascaris can affect transport hosts, so if that infective stage went into other hosts here like the rabbit, it can cause them that larva, if there's an exorbitant amount of larva migrating into a tissue, into an organ, into an eyeball, we commonly see symptoms with the parotenic hosts. But in the primary host, the raccoon and the other wildlife species, we typically don't. We diagnose it the same way in the fecal float. Yes, we can see adults, but unlikely to see them. That says minimize contact with areas infected or inhabited with raccoons. So if you work in wildlife rehab, that's unavoidable. You'll have to go into those habitats, but you're cleaning those habitats frequently. If I am going hiking in Pierce County, which there are a lot of raccoons, I certainly decontaminate myself. I wash my clothes, I wash my shoes, I wash my hands, just in case if I touch something that was contaminated. The same diseases that are possible with Toxocara are possible with Bayless ascaris. So the ocular larval migrans, the visceral larval migrans. We can protect ourselves by picking up that feces ASAP. Now, in all of the roundworms, Toxocara canis, Toxocara cati, Toxascaris leonini, Bayless ascaris procyanus, all of them, to kill those worms, we would use a dewormer that would be effective against roundworms. Anti means against. Helminth is a parasitic worm. So an anthelmintic, anti-helminth, is a dewormer, anti-worm, dewormer. And the common dewormers that we use to kill roundworms are only capable of killing adults. So the adult stage only. Dewormers, we don't have a dewormer that has the capability of killing roundworm eggs or roundworm larvae. And so when you come across a dewormer that kills roundworms, you're going to see these instructions. Treat today, or treat whenever you're going to start treatment. Then again, treat again 3 weeks later, and then maybe even 3 weeks after that. Why do you think that is? Well, if you treated an animal today, it's going to kill any worms that are in their intestines. So again, remind those owners that you possibly could see those worms come out in the feces. What if there are larvae migrating somewhere through the body at that time that you treated them initially? They're not adults, they're larvae. And hopefully in 3 weeks they will be an adult when you're going to treat them again. Use that same dewormer in hopes that 3 weeks later you're going to kill all of those parasites that 3 weeks ago weren't mature, weren't adults. And you might do it again 3 weeks after that, just to ensure that all of those circulating larvae, migrating larvae, are now an adult. And again, remember that roundworm dewormers can only kill adults. So if humans have the zoonotic infection, ocular larval migrans, visceral larval migrans, that's a larval problem. And if we used a dewormer, it's not going to do anything for us, because we don't have any drugs on this planet that will kill circulating larvae. Interesting. Control of all roundworms. We've discussed some of them. I've mentioned that regular fecal exams are recommended by the AVMA. I was watching last night, reading last night on a Facebook post. I have Facebook liked a site called Clinicians Brief, and last night they had an article on regular fecal exams. So if you are a Facebook person, I would encourage you to check out this site. We also would recommend more frequent fecal exams in animals at risk. I tend to check my dogs more than once a year because they do some hunting on our property, they do some scavenging, they're kind of funny that way. So I tend to check their feces more than once a year. Strict sanitation. Now that's kind of a lame statement. What are some examples of strict sanitation? Well, if your animal has been diagnosed with roundworms, we would want to we would encourage you to, as soon as the animal defecates, to pick up that stool ASAP. Before that animal or any other animal has the possibility of stepping in it and then grooming themselves and recontaminating themselves. Another example of strict sanitation is after picking up the feces. I'm going to more so talk about control of roundworms in humans. Well, let's talk about that now. If we wanted to protect ourselves, hence controlling the spread of this parasite, we would want to wash our hands after handling the animal or picking up the feces, just to ensure that if we accidentally did contaminate ourselves, we'd wash away any possibility of having it go into our system. Anytime you are cooking, wash your hands before cooking. And of course, we know that we're going to treat all puppies and kittens. So again, what if I'm a client and I come in with a brand new puppy or a brand new kitten, and you are sending me home with a dewormer? You're going to talk about the dewormer and how to effectively treat for that for this parasite. Treat today, treat again in 3 weeks, maybe 3 weeks after that, and explain to the owner why that is. When that animal defecates, pick that stool up ASAP. Clean that litter box every day and dispose of the feces in the garbage. And thirdly, wash our hands very frequently. Here are some common dewormers, and thelmintics that have the capability of killing roundworms. Now, on a side note, I want to talk about trade names versus generic names. Every drug has a generic name, which you could also say is the chemical ingredient or the drug name. Some drugs are manufactured by companies and have these special names given to them. Whenever you see a trade name, it will have some sort of symbol behind it. Here I put a copyright symbol. It could also be a TM, that stands for trademark. It could also be an R, which stands for restricted. Anytime you see a letter like this, a C or an R or a TM, behind a name, like there's in small letters here a TM, it tells you that this company has taken an ingredient and given it a special name. And no other company on the planet can use that name. That's special to them. For example, ibuprofen is an anti-inflammatory that you might use to treat a headache or some aches and pains. Ibuprofen is the generic name or the drug name or the ingredient, the drug name, the generic name, the chemical. But some companies market that drug name as Advil. Now that company that produces Advil, no other company can manufacture that product and use that name. They can take that ingredient and give it a different name, anti-Tracy headache, but they can't call it Advil. So I'm going to introduce you to dewormers and parasiticides throughout the course of the semester, and I'm going to introduce them all by the drug name, but maybe some other common trade names that you might see. I would encourage you to go shopping, yay, but shopping at Target, at Menards, and especially companies like Tractor Supply or Fleet Farm that market to a lot of farmers. So a lot of farmers go shopping there. They have a large selection of dewormers. And so I encourage you to check it out and investigate these parasiticides that I'll introduce you to throughout the semester. Piperazine is one dewormer that can kill roundworms. A common trade name is pipitabs. And when you look at the bottle of piperazine or pipitabs, you will read that it is very safe and effective. It only kills adult roundworms, but it only kills roundworms. Only. So if you have an animal that has roundworms, great. Pipitabs will work, or piperazine will work. Pyrantel, the full chemical name of pyrantel is pyrantel pamoate. But again, I'm just simply going to call it pyrantel. That's the drug name, the generic name, the ingredient. It goes by many different trade names, but these are two real common ones. I like the name Nemex. Here's Nemex right here. Roundworms are a type of nematode or nematode, a cylindrical worm, and X, eradicate. So I like the creativity there. I'll explain when we get into large animal parasites where this term stringent comes from. Pyrantel, whatever trade name you'll see out there, has the capability of killing roundworms, adult roundworms, also adult hookworms. So you're going to see in our next discussion when we talk about hookworms, hookworms are also very common. And so if you have an animal that is infected with roundworms and hookworms, hey, this is one-stop shop. This product, if you dose the animal correctly, it will kill both of those parasites. And of course, we're going to retreat 3 weeks later and maybe even 3 weeks after that to ensure that we eradicate any parasites, all of the adults, all of the parasite infecting the animal. We're going to talk about fenbendazole a lot throughout the course of our semester. Fenbendazole is the generic name. The trade name is Panacur. Pan means a lot. Cure, to eradicate, to get rid of, cure. So this means cure a lot. And you're going to see throughout the course of the semester, fenbendazole can kill adult roundworms, adult hookworms, adult whipworms, adult threadworms, some tapeworms, some flatworms, some flukes. It can do some, it's got a lot of good indication to kill Giardia. So it does a lot. I will tell you that we do not have one drug that can kill all parasites. I wish we did, but we do not. So let's say if you had an animal that had roundworms and whipworms, then this would be a great product to use because we know that this would have the capability of killing both of those parasites with one product. So the goal here is to have an awareness of all of these drugs that I'm going to introduce you to, and to ideally choose one product that has the ability to kill all of the parasites that that animal is affected with or afflicted with. As we take this information that we've learned about roundworms, let's now apply it to hookworms. Hookworms are also nematodes, so as an adult they look like a cylindrical worm. But one difference here, one similarity is that these adults will live in the intestines, same place. They will steal nutrients, but they also have the ability to suck some blood. Roundworms do not. Here is the head of an adult hookworm, and it has these little teeth-like mechanisms. So these teeth, when they're hungry for blood, they will latch onto the intestinal wall, and they have the capability of sucking 1/10 ml of blood in a day. So if I have one hookworm in my intestines, I'm not likely to become anemic. But what if I'm a little puppy or a little kitten afflicted with hookworms, and because of my size, because of how much blood I have, if I have a lot of worms, I certainly can become anemic. This was just a cute little dog I had back in the day. Cooper is now deceased, but he loved to wear costumes, and so here he is as a shark. We have two common hookworms that small animals can be affected with, ancylostoma, ankylostoma, however you want to say it, and Ansonarian. Ancylostoma can affect both dogs and cats. All hookworms reside in the small intestine, and you can see here that here's a piece of the small intestine on necropsy, and look at how bloody it is, how diseased it is, how inflamed it is. And so if you had a patient that had a significant case of hookworms, you could appreciate some blood in the feces, excuse me. Now, what color of blood would you anticipate? Now, remember that if there is bleeding distally in the gastrointestinal system, like the anus or the rectum, maybe something cut the anus and the rectum, it would be more fresh blood, bright red blood, like the color of a bright apple. Versus old blood, blood that maybe if there was bleeding up in the small intestines, and by the time that blood got to the outside the anus, it would be more old, it would be older, it would be darker, dark burgundy, possibly even black. So again, that can be very informative if you do see blood on the gross examination of your feces. The eggs look much different than roundworms. We have a thin little membrane, and we have these little circles inside. We call this it's a bunch of cells, and it's called a morula. And ultimately, this morula of cells will mature into a larva, so a free-floating larva. And again, that larvated egg stage, that's going to be the infective stage. That's what the animals need to ingest when we talk about that. But we've been, you are introduced to this egg in the first week of our lab. Adults, they look like smaller roundworms. So take a piece of spaghetti, but cut that spaghetti kind of in half and make them a little bit chubbier. Also, if this hookworm had recently ingested some blood, it might not look cream like you see here, but instead brown, because you'll see that blood in their intestines. You can also see that these worms have a little hook at the end. So if you do see that, there are different ways to differentiate a roundworm than a hookworm. Don't worry about southern hookworm and northern hookworm. You can classify them both as hookworms, but I will tell you that ancylostoma was first founded in the southern states, so that's why it's been given the name southern hookworm. All hookworms have a direct life cycle, but you can see here that somatic migration, that means some larva must have gone hibernating in hopes that something woke them up, and also tracheomigration. Ultimately, you know that these are direct life cycles. Transmission. We need to ingest, that dog or that cat needs to ingest the infective stage of the parasite. We also have the possibility of transmammary transmission. So mom can give the larva that were woken up, what's that term? Hypobiosis, through pregnancy. But we also have a special one here, something new. If there is larva in the environment, and this dog walked on some of that in the infective stage, that larvated stage, the larvae have the ability to migrate through the skin. Now again, the common symptoms of hookworms are going to be a dry hair coat and a pot belly. So those are going to be the real common ones. But again, the possibility of anemia is there if we have a high amount of worms, and think of especially even small little patients. If we do have anemia, which is a lack of blood, lack of red blood cells, we can see symptoms like pale mucous membranes, prolonged CRT, and if we don't have red blood cells, hence oxygen getting into our cells of our body, then we could struggle with things like weakness. We again can see that dark red blood in the feces in the gross exam. Again, prepatent period, I'm not testing you on it, but you certainly remember it's infection to detection, and we rely on finding the eggs, more specifically, which part of the fecal exam? Is it the gross exam, is it the direct smear, or is it the fecal float? Of course it's the fecal float. Again, we can detect our adults on a necropsy, but again, we like to treat our patients when they're alive, right? This species of hookworm, just this species of hookworm, just Ancylostoma, is zoonotic. I found this picture on Facebook and I thought it was awesome. I don't want it. I don't want myself to look like this, but here you can see tracks of the larva into the eyelid. And so this person was probably a technician or a young kid, who knows, and they weren't taking the necessary precautions. Their fingers were contaminated with the infective stage and they rubbed their eye. Ooh, here is a person obviously stepped in something, that a contaminated environment, allowing the Ancylostoma larva to migrate through their feet. And you can see these tracks. So these tracks are anatomically called a cutaneous or cutaneal larval migrans, migration of the larva through the skin. It's also known as creeping eruptions. And not going to kill you, certainly probably a little uncomfortable. Not going to kill you, very uncomfortable. You can see that this foot is infected. Look at all that green, ew. So it's something that you have to live with until the larvae die, because you're going to see that the dewormers we have to treat hookworm can only kill the adult stage. And this is not an adult down here, or in here. These are the larval stages. Uncineri is the other genus of hookworms common to dogs and cats, and all hookworms reside in the small intestine. The big differences are size of the egg. Big deal, I guess. In lab, I told you didn't have to differentiate. This one is known as the northern hookworm. Uncineri is known as the northern hookworm, but big deal. You can just call it hookworm. It was founded more so in the northern states, but of course, due to mass transit of animals, it's all over the United States now. Uncineri does not have cutaneous transmission. Uncineri can only be transmitted by direct ingestion of the infective stage, and also transmammary. Because there is no because there is no cutaneous transmission, it does not make this parasite zoonotic. Of course, you're going to protect yourself as a technician, wearing gloves every time you're working with feces and doing your fecal examination. Here are some common dewormers for hookworms. Now, I've already introduced you to pyrantel. pyrantopamoate, which goes by the trade name Nemex and Strontium T. You know that pyrantel can kill roundworms and it can also kill hookworms. So again, if you have an animal afflicted with both of these parasites, pyrantel can kill both of them. I want to jump down to fenbendazole, which has the trade name Panicure. Here's one. I put a picture here of Panicure. This is Panicure for horses. So you're going to see a lot of these anti-parasiticides, drugs that kill parasites. We have fenbendazole for small animals. We have fenbendazole for large animals. Panicure can treat both roundworms and hookworms. I wanted to